Tell you what's on it. Well, I'm not just you. I'm gonna tell everybody, and we'll give you hints, shall we say? Okay. So you can decide if you want to take it tonight, or if I mention things like you got to know about Phenergan and Voltaren and stuff like that. If you don't know that stuff, then you can take it next week. But I'll let you take it tonight. If you want. But once you take it, you only take it once.
You only take it once, what?
You only take the final ones.
Okay.
That's it. Okay.
So if you take it once and don't do well, what do? If you get
You have to take the class over again.
the entire class?
Well, yeah, because obviously, if you didn't learn, I got chapters, I got questions in each chapter. Yeah.
So those people that need to come back for the supplemental 6 hours or whatever, that's the test they take after their, like that person that said.
Oh yeah, the person for the 6 hours. Once you take your QMA test and it's sent to IB Tech, and you have not passed it through the IB Tech process, they send them back for a 6 hour refresher, if you will. That's just how they do it. And then they could do that 2 times because they're allowed to take the test 3 times. It's IB Tech. They have like hundreds of tests.
Less than a second. This requires you to take the whole 40 hours or whatever.
Yeah, that was a
What it
Yeah,
was
no.
also explained that we could take the test next week too. So
I don't want the rest of you guys to feel like I gave you the answers and I cheated you out of study time. Okay, but if you care to take it, then you can take it. I'm willing to sit here while people take it. Anyway. Okay, are we ready? Somebody left the phone. Okay, that's fine. You're done. It's gonna sit there. All right. It's really not that hard, guys. Okay. Are y'all ready? Insulin is a hormone produced by and then it's got answers like A, B, C, D. Okay. The QMA, and now remember I have like 10 homework questions on here. Okay. 1 second. Before you take your state exam, I need your timesheet with all your initials, and then you sign it and date it at the bottom. Okay. I need your packet of tests, the 1 through 11. Okay, it's got the scope on top. I highly suggest you keep the scope because you're going to have 10 questions on your state exam, all 10 related to the scope. Okay, so you might want to keep that paper, but it's in this book, so whatever. So I need 3 things. Your final, your hours, and your test. Bring next week if you're coming or whatever. Okay, that just has to be in your file. Okay, the QMA is prohibited from performing what tasks? Glucophage is, and please don't answer these out loud, okay? Because I'm sure you guys know what this stuff is anyway. Remember the word gluco means sugar, okay? So when you're looking at stuff, look at the, I have to check this out. Look at the word. 1 second. Okay. Question about thyroid hormones. It actually says thyroid hormones question, and then it explains the process. I told you guys 12 to 12:30, so you're not late. So, yeah, I wasn't sure. I came straight from the doctor, so. All right. She'll give you the first 2 questions. Thyroid hormones. you need to know about Lanoxin or digoxin. Okay, we've gone over that many times. What rule you think it is probably the question. Okay, it's very similar. It's talking about rotating transdermal patches, kind of like some rules for that, or how you do it, or whatever. Before giving an antihypertensive drug, you should. And then you fill it, the answers are there, you just circle it. Okay. The systemic effect of a medication, and then it gives different definitions, and you circle the definition it is, right? I mean, is this foreign to anybody? Okay. The question just says the systemic effect of a medication, and then there's A, B, C, D, and then you would like circle the other half. Okay. Factors that influence medication action. This is in the book. We've gone over this. You know, like if you're really old and your organs aren't working good and stuff like that. Let's see. It talks about the male sex hormone, thyroid hormones. I think that question is on here twice, so if it is, then you get a freebie. Or if you're not sure, you know, whatever. I'm going to have all these retyped over after this session. I mean, the same kind of questions, but I shouldn't have two of the same on the test. That was a boo-boo of mine. Where are meds metabolized? Which of the following is a true statement? And it's talking about enteric-coated tablets and capsules. So I think as soon as you read the answer, you'll know. Okay, for example, like timed release compared to regular, you know, and then your crushing rules and stuff like that. Okay, I'm telling you, it isn't tricky. Really, it isn't. Let's see. This is from your homework, and this is in your book like 3 times. It's talking about the med card. Okay, so you guys know what you should do with the med card, right? It's what you think you should do with the med card. Oh, when you're not using it, of course. Remember I told you you needed to know the difference between side effects of, well, you know I didn't tell you this, of steroids and estrogen, okay? That's actually what it breaks down to. And there is one thing in here that tells you which one it is. That's all I gotta say. This is what happens when you take steroids. This is what happens when you take estrogen. Okay, but it doesn't say that. But essentially, that's what it's asking. Just adverse effects. Now we have the QD, the BID, the TID, the QID, the QOD, the HS. You know, all those abbreviations. STAT, PRN, stuff like that. This is talking about, it gives you 1, 2, 3, 4, 5, 6 examples of a drug that are exactly the same thing, and it asks you what are they for. Out of those 6 drugs, I guarantee you will recognize at least 1 or 2. Really, we've gone over it many times, okay? And it's just asking you, it's kind of like, it would be similar to a list of antibiotics, and then one isn't an antibiotic, and say, which one is not an antibiotic, okay? So it's kind of like that. I know you guys know the answer, okay? Don't hurry when you take the test, okay? So there's a lot of questions regarding things like levodopa. Okay, that's all I'm gonna say. There's like a bunch of meds, and levodopa is one of them. Okay, so that should help you This one is straight from the homework book, so when you read it, you'll know, because we've gone over all the answers. What do you do before you give someone dig? Okay, you guys know that answer. I'm telling you, it's not hard. So it talks about eye drops and eye cream and like how we administer them. Okay, you know that. It's talking about, this question is talking about antibiotics and why it's so important to like keep them regular. Okay. So this is about antipsychotic meds and monitoring patients when they're on antipsychotic meds. This is an immunity question. You know how we have like active, passive, acquired, blah, 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 blah. Okay, so this is just that gives you the definition, and it says which immunity is this. Gives you a list, and there's 1, 2, 3, 4 drugs, and it asks you which of the following is not an antidepressant. They're familiar names. Okay, I didn't pick in there. Oh, I do have both of them. I do have the generic and the trade name on there. Okay, it's asking you about the 3 drugs for Alzheimer's. I told you guys that'd be on the test. Okay. Which of the following is not an antipsychotic? Antipsychotics, by the way, are also known as neuroleptics. So after the words antipsychotic, it's got neuroleptic. Just means it's a psych drug for the head. Okay. And okay, yeah. This should be easy. I've hinted at a few things on that one a few times. This is asking you how long do we wait between, like, and I know the other questions are on here. Eye drops, inhalers, I think that's it. Yeah, eye drops and inhalers. How long, you know, like if we have 2 drops, and then, so we went over the drops. I'm just telling you guys. So this question is, which of the following is not correct when placing on a medication patch? So it is, you guys know how to put on a patch because you did it, right? So it's not one of those 3 things. It's the other one because you know what you did. You know, a couple students have trouble with this, so I really want you guys to look this up because we're going to be here a while. I want you to look this up. Which of the following is not a liquid dose form? If you look in the book, it's got a list of a bunch of, you know, liquids, and so it's got a word in there that is not a liquid. Let's say it's topical or something. Okay, so you know that's not a liquid, but that's not what it is. But you'll be able to pick it up, hopefully. Anyway, look that up if you don't know. I think there's 4 names. Alzheimer's, antipsychotics, meds, med patches. We just talked about that. Liquid dose. Okay, these are time release. These are time release. Oh, you're so stupid, Pat. These are true and false. Okay, so I'm going to read you what the topic of the true and false are about. Okay, the first one is about timed release capsules. Okay, we went into detail about what we do and don't do with time release capsules. The next one is enteric coated tablets. This is talking about crushing and putting in applesauce. this is, remember I explained the process to you that when we give them pills and we give them cough drops and how we have to separate sometimes meds between each other. So that's kind of what, it's more on the cough syrup side, okay, relating to this question. This is one about, it's saying that they're having so many drops in an eye, and it's giving you like the OSOUOD kind of thing, so you gotta like know what OSOUOD is. This is a question related to when you pour liquid meds. There's a couple of rules for, like, you know, liquid meds. All right, so I know you know them. Once you the answer. It asks you side effects of nausea and vomiting drugs, which you could probably guess. It's asking you about doctor's orders and things that you do. Like for example, just as an example, the doctor comes up and says they need 2 Tylenol. Okay, well you just can't go and give them 2 Tylenol unless they already have an order for it, right? So it's kind of like that, kind of. And these are true and false. We're still talking about it. You should know the difference between stool softeners and laxatives. Okay, there's only a couple of stool softeners. You need to know the difference between the laxatives, Milk of Mag and Metamucil. You're not even paying attention. You're looking through your phone. Do you know this stuff already? It is easy. Good. Good. This is talking about anxiety and how it affects the body. Okay. There's a Tylenol question. Acetaminophen is what it says. There's a question about the side effects of anti-seizure drugs. How long, we already talked about how long you wait between the different meds. There's just a second question about this. It's talking about like ear meds, like remember the special thing we got to do with ear meds and stuff. And then it's saying your clinical hours, like how many hours for a med pass. It's got an hour here, and you just write true or false, and then how many hours a day, which we've gone over. Does it? Okay, you guys remember that? All right. This is a CNA question about an emergency procedure. Is all I'm going to say. It's easy peasy, but I don't want to. Yeah, give you everything. Okay. Oh, this is a homework question here. It's got to do with like somebody having diarrhea. Okay. These are the 4 choices, you know, A, B, C, D now. Okay. So it's telling you somebody's med is ordered like QD, BID, TAD, whatever, and you have to say what that is. And you know what I mean? So, yeah. This is when we treat glaucoma. Different drugs we use. It's the most common. That's all I can tell you. You need to know about Vasotec. I believe there's 2 questions. I believe. Vasotec. VASOTEC. This is talking about the G-tube. Just kind of easy. It's how you do it. How would you get the pills from the bottle into the G-tube? Okay, so it's kind of asking you the process for that, which you guys all know what that is. Let's see. This one's talking about oral care. This one's talking about when you document your meds. This is about dressings and skin tears and such. So it's got a list of meds, and one of them is an anti-seizure, and it asks you which one it is, and let me see if it's very common. Oh yeah, well, at least to me, but I didn't try to pick hard drugs. I really tried to pick the ones we talked about. Here's another question. Well, here's a question about Voltaren. Voltaren. Oh, you guys could have put them up here, but whatever. I'm sorry, I didn't even think about that. Then there's something about Bactrim suspension. That's the drug. Bactrim suspension. So I'm telling you. You should know what the word suspended means. Okay, so that's part of it. Here's another Voltaren question. There's an enema question. There's a couple of Alzheimer type questions regarding behaviors and stuff. It's got 3 questions on different eye drops. You got to know the different kinds of eye drops that we use. Let's see, one at the doctor's office, one to lubricate the eyes or to lower the pressure, and the other one's a combination. Tegretol. That's all I'm saying is Tegretol. That's all you get. Okay? Next one is Cogentin. 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 So these are some matching words. I will tell you a few of these matching words are on, remember that word puzzle I told you guys to do with the diseases, and it's got the hints? Well, the hints actually are the definition to that, okay? So just look at that, okay? I'm only asking one question from one of them. It's near the top of the list, if that helps you, on your word find page. So we're talking about abnormal neuronal nerves discharge in your central nervous system. So there's a drug that affects your nerves in your central nervous system. Once you see it, you should get it. Okay, so there's a list of 5 drugs. Well, there's actually 4, and one of them is B and C. Okay, but there's a list of 4 drugs, and it says which of the following is an antibiotic. Okay, they are not weird ones. Okay, if this helps you, they're a little bit on the older side. Okay, we still use them though. TB drugs. The aging effect on the respiratory system. Okay, I'm going to say 3 words, and that's all I'm going to say. Platelet aggregate inhibitors. Bless you. The next question, which of the following are beta blockers? And then the next one is side effects. Okay, and the last like 10 are true and false. Because I went over every single question. Okay. It's talking about, and you could probably guess if it's talking about a disease, they probably want to know a treatment for it. I'm just saying, okay? Pediculosis, scabies, athlete's foot, swimmer's ear, this is asking you if this is a bronchodilator. And it asks you a couple questions about cough meds. You know, because we've talked about 3 different cough meds. Then this is telling you about when you should turn your clinical papers in. It's kind of the stuff I told you about. Side effect of Sudafed. And that's it. That is every single question. Like I told you, it's not that hard. I will tell you, 100% of the people in Maryville passed it. I think the highest grade was an 89 and the lowest grade was like a 78 or 80 or something.